very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, the topic of today's session is Heroes Fight for Health on the Prostate Cancer Awareness. And this initiative is supported by Zydus Life. Prostate cancer is one of the significant health concerns in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all the cancer cases in Indian men, with an estimation of 1,05,000 new cases reported this year. Additionally, it is a leading cause for cancer-related deaths with around 30,000 fatalities in 2020 alone. These statistics highlight the urgent need for enhancing early detection, prevention, strategies, and treatment options to address the growing impact of prostate cancer in India. So, in this session, we are going to discuss and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion first, I would like you all to join me in welcoming our expert who is going to provide us with insightful information on understanding about the prostate cancer awareness. I would like to welcome Dr. Pavan Ragava Reddy, Consultant Medical Oncologist and Director, Arka Hospital and Research Institute. Good evening, Doctor. Welcome to the discussion.
Good evening, everyone. Thanks for the session and discussion regarding prostate cancer.
So let's delve into the discussion. To begin with the discussion first, Dr. Reddy, I would like to ask what are the most pressing gaps in prostate cancer awareness in India today and how we can effectively address these gaps to improve public knowledge?
Yeah. So, as rightly mentioned, one of the most common cancers to affect the general population. So, this is of the elderly. The incidence of prostate cancer increases with increasing age. If the person is up to 90 years old, there is a 90% probability that he will develop prostate cancer. So, what's the major difference between our country, the situation in our country as compared to the Western population is definitely a lack of awareness. So the major thing that we are lacking here is a lack of screening facilities or the lack of awareness among the people that there is effective screening available for prostate cancer. One of the major reasons for this is limited educational qualifications of our extremely rural population. Other thing is there is something known as a care gap. So basically, the people in the rural population do not have much access to oncological services, whereas those people living in the urban populations in cities, they're well off in terms of approaching healthcare facilities and approaching oncological centers. So there is this wide care gap that exists in our general population. And there is also some to some extent unmet need in social media engagement also. We have social media engagement for various stuff, but when it comes to healthcare awareness, especially cancer awareness, when we talk about cancer awareness, it is usually about breast cancer, cervix cancer. These are much more common even in social media. The awareness and the importance given to breast care and cervical cancer, etc., are much more common. But prostate cancer is seldom discussed even in social media. So I think these are all the unmet needs in prostate cancer awareness.
Very rightly said, Dr. Reddy. And in your experience, what are the most common barriers that prevent men from seeking screening for prostate cancer and how we can overcome with these obstacles?
Yeah. So basically, prostate cancer screening, each and every person beyond the age of 45 years or 50 years, they can undergo prostate cancer screening. Prostate cancer screening usually comprises of a simple blood test known as the PSA level and a procedure known as digital rectal examination, which may be followed by a few scans such as ultrasound scan or an MRI scan. So most of the people do not even know the fact that there is a prostate cancer screening facility available. The major reason for this is again to some extent lack of education, and sometimes there is a fear of diagnosis. So patients may be afraid that they may be diagnosed with cancer, and they may be afraid of the procedure itself. Per rectal examination or digital rectal examination, patients may experience some uncomfortable situation during the procedure, and again they may be afraid of undergoing a biopsy, a needle test. So these are some of the barriers to screening, and ultimately some of them may have fear of getting diagnosed with cancer earlier and taking treatment for it, which may again result in some adverse side effects such as erectile dysfunction or urinary incontinence. They may have all these misconceptions. So because of these reasons, still even today, prostate cancer screening is not as much as it should have been. Actually, these are the common barriers.
Moving on to this question, can you discuss the current state of prostate cancer awareness in India and the key areas where public education is actually needed?
I think definitely patients need to be educated through various media. Social media is one aspect. I think what we have to see is we need to identify target audiences. So this is basically a disease of the elderly. So I think we can target populations who are like retired employees, or old age homes. So or geriatric clinics, family physicians. So whenever they get a chance to see a patient who comes for other diseases, such as maybe they can come for a diabetic checkup, they can come to check their BP. I think these are the areas where we can focus upon, and these are the populations where screening actually plays a role. There is a chance that we can pick up the cancer early and give them appropriate treatment, so that there is a possibility of complete cure. So once we identify the target audiences, I think we need to create some engaging materials, some audio, video materials to explain to them better that this is a completely curable disease if we detect early. So hence they have to get screened. So I think the second step is to identify and create engaging materials to convince these people to undergo screening procedures. And finally, sometimes using data analytics, using search engines, etc., to see the patients who are actually in need of prostate cancer screening, or those who are searching for prostate cancer related information. I think those data also we can compile, and then we can target our efforts towards bringing these patients to the clinic, and explaining them about the screening techniques and early detection techniques, and then go ahead with treatment. So I think this is the way forward.
So, Dr. Reddy, in your view, can you explain how a holistic care approach address the comprehensive need for the prostate cancer patient beyond the standard medical treatments?
Yeah, so standard medical treatment is definitely required for any case of diagnosed cancer. So I mean, everyone knows the common modalities of treatment. It is surgery or radiation, followed by some chemotherapy or some hormonal manipulation. So beyond this, I think we need to think in terms of holistic care. So by means of holistic care, I mean to say that apart from these therapies that are delivered in a hospital or a nursing home, I think complementary medicine and more emphasis on diet, diet, exercise, and then again yoga, meditation. All these things are required for patients for going through the treatment, which is usually very strong on the patients. So I think these holistic care will support the patient to go through the treatment without any much adverse effects, without any chance of them leaving the therapy in between. So I think good diet, the patient should be counseled about the diet, fresh fruit and vegetables, antioxidants, stuff like that. And then they should be educated about physical activity, not to have a sedentary lifestyle. And then maybe we can give them some supplementary vitamins or minerals, and as and when required, they're advised to practice yoga and meditation to have that emotional stability, and that power to overcome the disease. So I think this is what constitutes holistic care for not only for prostate cancer, in cancer, for in generally for other forms of cancer also.
Thank you, Dr. Reddy, for these insights. Since you mentioned about the physical activities, yoga, and dietaries, maybe you can provide us with some recommendation to the patient who are suffering from prostate cancer. Like, what lifestyle should they choose? What physical activity are there that they get engaged into? And maybe what dietary modifications are there that are going to help them?
So, physical activity, there is clear-cut clinical data to say that those patients who adopt an active lifestyle, with good amounts of physical activity, exercise, they have lesser chances of their disease coming back, and they have which will eventually translate into better survival, overall survival of these patients. Apart from this, those who are physically active tend to face chemotherapy or other forms of therapy in a much better way. So they are less prone to have adverse effects of all these diseases. Regarding diet, nothing in specific. Then they are supposed to have a balanced diet rich in fiber and a good vitamin and micronutrient content, less in fats, less in sugars. So I think these are all the dietary advice that we would like to give them. And again, sometimes some forms of complementary medicine, such as especially acupuncture can be an effective additional therapy for those patients with severe pain. So prostate cancer patients are prone for bone metastasis, which causes them severe pain. So acupuncture, in addition to relieving pain, sometimes has been shown to even help them with chemotherapy induced nausea and vomiting also. So acupuncture can help them cope up with the nausea, vomiting that they face during chemotherapy. So I think these are some additional stuff which are usually overlooked by the physicians when they're treating prostate cancer. I think giving them this holistic care would definitely translate into a better survival for these patients, and definitely any day better quality of life. So even if it is metastatic stage for prostate cancer also, what we try to offer to the patients is, sometimes we admit to them that this is advanced case, we are not going to cure you, but what we are going to try to give you is a better quality of life, a dignity of life. So how long you are going to survive, beat me in months or years. So what we try to do is give them a good quality of life. So definitely this holistic approach beyond the standard therapy will definitely help them achieve this dignity of whatever life is remaining for them. So this is how we look at it.
Thank you, Dr. Reddy, for your insights and recommendations. So, we talked about the physical activities and diets, but when it comes to emotional support, what strategies can caregivers use to provide emotional support to the prostate cancer patient, and how can a healthcare provider assist caregivers in this role to give them the much care?
So I would like to look at it as a triangle here. So the patient is at the apex of the triangle. The other two corners of the triangle, one is a healthcare provider, which may be your physician or your surgeon, your oncologist who is offering the therapy. So the other crucial point here is the caregiver. So the one who actually take care of the patient at home and for most of the time. So it may be the spouse of the patient, it may be a sibling of the patient, it may be another family member or a very good friend. So caregivers play a major role in the entire journey of the patient, right from the initial diagnosis to the initiation of the therapy and following up through the therapy. And once the therapy is over, also they'll have to undergo some form of rehabilitation. And sometimes when we know the disease is incurable, the final stages, terminal care, palliation, palliative care. So all this, through all these stages, the caregiver is of prime importance. So what do the caregivers actually do? So emotional support, though, they're there always. So they're always there. They always give a shoulder to the patient to lean on. So whatever emotional support that is usually taken care of by the caregivers. So apart from the emotional support, the educational support, so the informational support. So talking to the healthcare providers, talking to the oncologists, see what forms of therapy are there, what forms of therapy should they travel to some other place, should they approach another specialist or something. So this form of informational support also the caregivers usually help the patients. And practically all forms of logistic issues, so whatever the patient bringing the patient to the clinic, taking them back, giving them the daily dosage of drugs, and practically whatever aspect, in each and everything the caregivers are of utmost importance. So it is very important that we coordinate with the caregivers and help the patient so that we have the best outcomes.
So, Dr. Reddy, since you mentioned about the informative content and education, like how can educational campaigns be tailored to different demographic regions or maybe to different stages of prostate cancer to ensure that the prostate cancer awareness reaches in the diverse community effectively?
So yeah, so this we have partially discussed already. So the first thing is we need to identify the target audiences. We can't just see, for example, when we have a drive for cervical vaccination drive, say for example. So cervical vaccination drive is we usually target it at young females. So we usually go to schools, we usually go to colleges, and try to give them some awareness and then motivate them to get a cervical vaccination done. So similarly for breast cancer also, we usually look at uh, women in the third or fourth decades, so that we can counsel them, see if they have any high risk factors, do a mammography, and pick up early lesions and then treat them when the disease is young. Similarly for prostate cancer, I think we are supposed to look at the geriatric population, more than 50 years or so, the retired population. This we can do via some social media also. We can do some live question and answer session like what we are doing right now. We can have some survivor stories. Those patients whom we have already treated, they can come, they can give us their stories. We can do some interactive social media posts on Facebook or Instagram, or so on and so forth. And then we can have complete websites itself, looking at giving educational content to the patients who need to know more about prostate cancer. We can do some email campaigns. So I think these are all some novel ways in which these are all widely being done in the Western countries. But in our country, again, as I said previously, prostate cancer though is lagging behind when compared to other cancers regarding awareness campaigns or screening or all these drives. So I think these are some ways in which we can increase the pickup rates of prostate cancer in early stages.
Thank you, Dr. Reddy, for your insights onto that. So, in your view, what role does the multidisciplinary approach works when it comes to prostate cancer patient and their treatment?
So not only prostate cancer, almost all the cancers need a multidisciplinary approach. So basically, when a patient is initially diagnosed, we do involve all the specialties of oncology, say radiation oncologist, we involve a surgical oncologist, we involve a medical oncologist, and then we try to check out a plan which is best for the patient. So each and every patient has got a tailor-made plan for their, not all diseases are the same. Like, see, the age of the patient may be different, the physical general condition of the patient may be different, the stage in which the cancer is presenting may be different, the type may be different. So based on all these things, we always have a multidisciplinary board when we come to deciding the treatment plan. So apart from this, we also include the psycho-oncologist for counseling the patients. We involve the dietitian, we involve the nursing coordinator. So it is always a multidisciplinary care that we give to a cancer patient. All the more for prostate cancer, because prostate cancer may require surgery, it may require chemotherapy, it may require radiation therapy. So invariably, we always have a multidisciplinary board discussion to go ahead with the final plan of therapy. So what the patients have to do is they have to look for a good team of oncologists and supportive staff. So who can check out this detailed plan and give them. So the patients also have the duty of maintaining proper medical records, and they also have to, if it is an advanced cancer patient, then they also have to look at all the palliative facilities available with the particular center. So I think this is all the responsibility of the patient also, to some extent, to participate and get the best outcomes for their disease.
Thank you, Dr. Reddy, for these insights. So, moving ahead with the care plan or care treatment for the patients with prostate cancer, in your view, how important does the patient support group is, and what makes a patient support group very effective in terms of providing the complete care?
So yeah, so patient support groups is a very well-known technique followed in the Western countries. Unfortunately, in our countries, we do not have active patient support groups in most of the centers. So, but then patient support groups can be either in person, they can be online, they can be telephonic. So basically, a group of patients who are undertaking treatment for the same disease, they form a group so that they can better communicate among themselves. They can share stuff that sometimes they may not be able to share with the healthcare provider. They definitely, with the help of this, they have this better coping abilities. Sometimes they may come to know about newer techniques, newer treatments the other patients are being, taking for their therapy. So I think these are all the important things that the patient can gain from their support groups. So ultimately, this will translate into a better cooperation to the treatment, better quality of life, and eventually better survival. So I think this is one unmet need where in our country especially support group formation is of paramount importance. But unfortunately, as of today, only very less centers have this provision of support groups.
Thank you, Dr. Reddy, for these insights. So, if we talk about the emotional and psychological challenges faced by the prostate cancer patient, what are some of the strategies are there for managing the emotional and psychological problems or challenges that they are facing in their treatment journey?
So, one of the major things an oncologist has to do is, apart from delivering therapy, they have to make sure that the patients are able to cope up with the therapy emotionally. So, we need to, get close to them like a family member, and then try to understand what they're going through, and then give them our expert advice or whatever. The second main thing is having a good support staff, nursing staff. Patients spend more time with the nursing staff than with the clinician, with the doctor. So I think having an understanding nursing staff who are actually trained in counseling the patients and then supporting them through their therapy is also very important. Third thing is again the caregivers, the family members or the friends. So they have to be very understanding, because this is a catastrophic diagnosis. So the patient's entire life goes upside down when they're diagnosed with cancer, all the more if it is advanced incurable disease. So I think caregivers are also of paramount importance. And then on a case to case scenario, sometimes we may involve psychotherapists, we may involve psycho oncologists, just to counsel the patient if it is beyond, if they're suffering from clinical depression, or sometimes they may need this specialist care sometimes. So accordingly we can bring in those people also to help them manage all these things better. So as a general advice, I think not only concentrating on the treatment alone, I think they have to concentrate on their lifestyle as well. So once they are diagnosed with cancer and they have started treatment, we should encourage them to have an active lifestyle, do some regular exercises, whatever exercises is feasible to their general condition. It may be a brisk walk, it may be some cycling or whatever, or it can be a simple yoga, meditation, sitting in one place. They can have profound benefits from yoga and meditation as well. So I think these are some ways in which we help patients to cope up with their disease better.
Thank you, Dr. Reddy, for these insights. I would like to ask how can advancement in technology, or maybe the new clinical trials which are going on, or maybe some advanced therapies that are going to come or are under process, how these advancements play a major role when it comes to the treatment for the prostate cancer patient?
So, when we talk about advances, I would like to bring in advances such as telemedicine also into this. See, with the help of telemedicine, always this care gap that I mentioned at the beginning of this session. So, all the people, especially from those rural parts, or those who are staying away from the cities, who do not have access to an oncological center, we may help them to overcome this transportation barrier. To better diagnose their disease, offer them better therapies. Sometimes even though they come to the bigger cities to take the treatment and then they go back, they face some problems, they face some side effects of the therapy. It may not be possible for them to travel all the way and again reach the oncological center. So sometimes telemedicine, virtual consultation, and stuff like that can help them a lot. Apart from this, research collaboration with various major pharmaceutical companies and other medical infrastructure. So definitely oncology is a ever growing branch. So we have newer therapies coming in daily, and we have newer indications of older drugs, also newer beneficial effects of older drugs. So I think it's very important for the clinicians to keep themselves updated with all the advances going on in the pharmacological branch, so that they can offer better therapies to the patient. And not always these newer therapies, they need not be costly always. Most of the times there are clinical trials going on. We can always enroll our patients, the needy patients, in the clinical trials, by which they can get the therapy completely free of cost. Sometimes we have got patient assistance programs which are rolled out by the pharmaceutical companies, in which even costly therapies, newer therapies are given for much lesser cost than we expect usually. So I think these are some ways in which newer treatments and research helps the prostate cancer patients.
Well, that's really insightful to know about such advancements when it's come to prostate cancer treatment. In the end, to conclude, I would like to ask for individuals that are newly diagnosed with the prostate cancer, what initial steps should they take and what recommendations or maybe advice you want to give to such patients?
So first thing that I would like to advise them is to not have any fear or apprehension. I would ask them to approach your clinician as early as possible and discuss with them freely whatever apprehensions that you have, whatever doubts you have. You're supposed to identify a good team of oncologists who are comprehensive. You go there, you have all the specialists, you have all the infrastructure needed for the entire therapy. So you have to correctly choose the team of doctors or team of clinicians or the hospital where you want to get treated. Second thing is your advice to maintain a proper medical record, all your investigations, all your imaging scans and biopsy reports, everything you're supposed to uh, sorry you're supposed to maintain clearly all these things, and then cooperate with the therapy, have a healthy lifestyle, have healthy diet, and then sometimes you need to be a part of support groups. You need to have a good caregiver who is willing to travel along with you through the entire length of your therapy. Sometimes when your cancer is quite advanced and you have limited time, so you need to think about your terminal life decisions also. So palliative options also should be discussed with your clinician. So I think you need to take more responsibility from the patient side, and the clinicians are always there to help you. So I think these are some advices that I would like to give to the patients.
Thank you, Dr. Reddy, for the advices. And I think these advices are really insightful for the patient who are going to watch this session of ours. So, in the end, to conclude, our objective for today's discussion was to explore and emphasize the importance for holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our experts have addressed the topic comprehensively and very effectively, and that the information in a very thorough and accessible way. So I would like to extend my sincere gratitude to Dr. Reddy for his insightful contribution and for sharing his expertise with us. Your participation has been really valuable. Thank you so much, Dr. Reddy, for joining us today.
Thank you, Sumedha, and thank you, Voice of Healthcare, for giving us this opportunity. Thank you.
Thank you so much.